Okay, I'm going to talk about how to hold the wax rims while you're setting your teeth.
شو بالله يا دكتور كنا نعمل
لا مش هي أنا هم Can you please pay attention a bit? Why I'm saying this لسه ما تقدر تصير بدأت؟ لا تحذفه. Please leave your work. Just a note about how to hold the teeth when you're setting. Once you're setting teeth, the wax is a bit soft. Okay? The wax is soft. So if you hold the wax rim over the glass slab and press from the side of the teeth might sink into position. Okay? They change their position. So once you go back to your articulator, you will find that there is a space between the upper teeth and the wax rim. So whenever we're holding and setting teeth, always hold your base plate and your wax rim from the side of the cold wax, okay? Second, whenever I'm setting anything, go back to your articulator, put in the upper, and recheck that it's closing on the lower, and what you're seeing on the glass slab is also present on the articulator. So wax-to-wax contacts are still there. Nothing of the molten wax dripped on the occlusal table. The occlusal table is still flat. When I'm looking on the other side, okay, when I'm looking at the other side, the teeth that should be touching the glass slab are also touching the lower wax rim. This is what we talked in the first quality check, where we said the occlusal plane is what? Defined as here. Is the contact between the upper and lower wax rim. And once we take the base plate outside, we use a glass slab to represent this occlusal plane, okay? So make sure you go back. So this is a case showing the problem that we had. Can you please take a close look at this case? The student had on the glass slab all of her features correct, but watch on when she placed it back on the articulator. Can you see the space? There is a space between upper and lower teeth. What happened? Why is her occlusal plane not coinciding with the wax anymore? What happens is when you are working with soft wax and you don't hold your teeth using the wax, what happens is you could even look closely, you will see the line. If you can look closely, can you see that the teeth have been pressed into the wax? Okay, so on the glass slab, all of the features are correct. But once she placed them on the articulator, it's not. Because the teeth were soft. She was pressing hard, like this. The teeth went inside, okay? So to do a check and to make sure that your setting is correct, when you're doing one half of the teeth, make sure the wax is continuous on the other side, and you always hold your base plate from the area where the wax is. So even when I want to check your occlusion, I always put this and press on the wax side, the cold wax side, and then check my teeth. So I don't press and hold the base plate from the teeth side, okay? I keep this hold from the wax side until I finish this half. Once I finish this half, I cool it very well before going to the other half, because this later I will lose this wax as a reference. So I will take the teeth as a reference. So if they are not cooled enough, the teeth while holding the other side, because I'm going to begin setting on this side, sir. I'm going to begin setting on this side. If these teeth are not cool enough, while I'm holding like this, they will change in position. So this is why we tell you, whenever you set a tooth by tooth, go back, put the base plate on the articulator, and compare your setting with the lower wax rim. Not to have this problem where teeth have moved in their position, okay? Thank you.